Yeah, this is definitely the creepiest portion of the chapter. However, when we start looking at those later chapters in the text, I think you're going to get creeped out a little bit in each individual body system. Things that I show you today are really meant to just be illustrative and show and like kind of tell you about the individual viruses. And remember, quite a bit of follow-up is going to be done. Now we're going to be hitting on, it's only week 5, we're going to be hitting on enzyme activity tomorrow, and then we're going to be looking at what's coming up with some of those bigger assignments. Remember, this class is not just quizzes and labs. We also have a couple of assignments associated with the course. So I'll make sure to preview those. So anything you see today is like, wow, I want to learn more about that. Make yourself a note, because you're going to have the freedom to pick something that interests you in a future assignment. So make sure you take notes of anything that you just really, really want to go investigate more on. And you never know. All right, so viruses are really an interesting cat. And part of the reason is dating back to some of the discussions I was even having with my A&P class yesterday. Michelle, we were talking about like thermal regulation. What happens to a body when it encounters an infectious particle is very commonly a body will raise a fever in an attempt to kill that particle. It aids the immune system. And so what's interesting is that because of the fact that many of us will catch a cold and never tell the doctor about it, or we'll even potentially get the flu and we'll just hunker down and weather it at home, we don't actually know the numbers of infectious disease that are out there when it comes to viral disease. In fact, imagine being the physician. Put yourselves right now into the role of the physician. What is the physician's job when a person comes in with an infectious disease? What's up? We're going to treat them, but what do we want to do before we even start treatment? We want to diagnose. We want to figure out what the heck is the root cause. How many times have you gone to a doctor, you're like, I've got the sniffles and I really feel under the weather, and the doc's like, I think you have a virus. They think. What virus? I think you have a cold. Okay, fantastic. Prove it. And unless they want to go through the next step of diagnostic procedures, at the end of the day, we don't even have a full grasp of which viruses cause which disease in everybody. We can get some of the big ones stand themselves out, but worldwide, we don't know how much infectious disease is passing around. The most common cause of acute infections don't typically lead us to going anywhere to a physician, so the numbers are really unknown. How many times have you gotten a cold and gone to the doctor for it? Probably not so often. Maybe as a child, your mom might have gotten concerned, or your caregiver might have gotten concerned. Otherwise, we suffer it through. There are definitely some viruses, some types of viral disease that infect in certain areas more than others, and that also puts us kind of in an interesting mindset, because we know that if we're in a certain area, if someone comes down with certain sets of symptoms, it might increase the risk that it is possible that it's that. If you guys are sitting here in Tucson, Arizona, and you start to tell me that your bones are hurting, your bones are aching, you can barely stand up, my first thought is not going to be dengue fever. But if you were in Africa, or if you're down in portions of South America where there's a lot of mosquito-borne infection for dengue fever, I might start to say, uh-oh, is it dengue? Okay? So it definitely depends on the region where we might even begin to start going with some of our diagnoses. Now this one's a cool one, guys. In fact, probably one of the scariest viruses out there is Ebola. Following Ebola, though, a few of the other ones that have plagued our society in pretty high amounts are these guys. All right, let's see. Ebola. You guys okay to watch an Ebola video? Think you're gonna creep yourselves out a little bit? I'm not trying, but I think it's interesting. All right, so this is kind of a behind the scenes of what's happening. This is in Liberia, which is one
this
of the
is the epicenter of the outbreak.
Epicenter.
In a city of 1 million, almost 50 new cases reported. Liberia's tiny band of healthcare workers are throwing everything they have to follow. This is Laureen. She's a mother of 4. She's collected hundreds of highly contagious patients since the start of the outbreak. She and her crew have been called in to collect a woman who's been taken sick. It's extremely dangerous work. The ambulance team are taking as many precautions as they can. They're getting into these white suits, plastic aprons, the hoods up, goggles and face masks, because When they go into these homes, the woman in there, we understand, is unconscious, and it's when people are in that state that they're most contagious. Excuse me, there's a tear in your foot. Any physical contact with the patient's bodily fluids could be a death sentence. Obsessive attention to detail can save your life. Laureen allows us to fit a small camera to her head before she goes in. The scene she's about to witness is one of horror, but for her it's a scene that's become an everyday reality. She enters the cramped home. On the floor lies what appears to be an elderly woman. Laureen is calm, professional. She stops and assesses the situation. The woman is alive. There are damp patches on the mattress. They could be vomit or blood, urine or diarrhea. Whatever it is, this whole room is infected with Ebola. One member of the team is the sprayer. His job is to constantly disinfect the ambulance workers and their environment with chlorine. Carefully, they lift the woman's emaciated body onto a stretcher. She's been lying in this room for days, abandoned by her terrified friends and neighbours. The patient herself is now a huge danger. She's an incubator, riddled with the virus. She's fighting for her life, but she needs to be isolated, and isolated fast. The ambulance crew painstakingly remove their overalls and decontaminate themselves.
Mail her line in a pool of blood, and she got.
She's very sick, Laureen says, but this is by no means the worst case she's seen. The neighbours say the patient is only 38 years old. One woman tells us she's her housemate. Are you still going to live in that same house now?
Yes, I live in the house.
You're living in the same house?
Yes.
She is scared, she says. She'll clean the place, but she has nowhere else to go. And this is how the virus spreads. In cramped neighbourhoods where a lack of sanitation and healthcare facilities fuel the outbreak, Liberia's healthcare workers are big on courage, but very low on resources. If you're sick with anything other than Ebola, you're in big trouble too. Monrovia's main public hospital is barely functioning. It's all closed down. Dr. Billy Johnson is the chief medical officer. He's fighting what appears to be a losing battle to keep Liberia's healthcare system alive. Most of the wards are closed altogether. The few that aren't are operating with a skeleton staff. Outside in the car park, we meet the Kiawu family. They're desperately seeking help for their elderly father. He's diabetic, but he's also exhibiting symptoms consistent with Ebola. Throughout the country, patients are being turned away from hospitals.
We have been to all the hospitals and no solution. So we are just waiting here for him to die in the car. That's what we're waiting for. Just see him die, Yeah.
The Kiawus leave. With the healthcare system at breaking point, they need to somehow get their father tested for Ebola. For doctors, this is a terrible dilemma.
Our training is hands-on. You want to touch the patient, you want to feel the patient, you want to be close by the patient. Now we cannot do that.
Medical staff are the most exposed to the Ebola virus. But Dr. Johnson, one of the most senior health officials in the country, says that their understandable precautions come at a cost. There must be many people dying from other diseases that could potentially be treated, but aren't because of this emergency.
Well, that's true. That's true. People with, for instance, stroke, hypertensive, diabetic patients, those even with malaria and typhoid. We show there are a whole bunch of people dying from those diseases that are treatable.
The Kiawus drive to a clinic run by the international medical charity Médecins Sans Frontières. Men in masks and overalls help him out of the car. MSF will test the father for Ebola. If he's positive, he could very quickly end up like the woman we saw being stretchered into the ambulance earlier, and his sons and daughter could face the same fate.
And how are you feeling? I'm feeling so bad that this kind of system will be in our
Your health, I mean.
For me, I'm okay, 100% okay. I slept.
It is in Monrovia's slums that Ebola is spreading fastest. In Britain, there are 280 doctors for every 100,000 people. In Liberia, that figure is just 1. Little wonder then that Ebola has been able to spread so rapidly. Later that night, we get a phone call from the Kialwus. They've got their test results. Their father does not have Ebola.
It's negative.
They've gone back to the general hospital to try to get him admitted again. This is a key moment for one man and one family. But more broadly, what we're seeing here is a healthcare system that itself has been infected by the Ebola virus and is on the verge of shutting down. The Kialwus are the lucky few. The certificate from MSF is their pass into the hospital and to treatment. As for the very sick woman who was stretchered off by Loreen, the ambulance worker, her fate, shared by so many others, tonight remains unknown.
All right, guys, so that isn't enough to make you think about the impact of viruses. There are some viruses that have a much bigger potential for their long-term outcomes. And so we can use some big terms, and we'll talk about epidemiology actually in a future chapter. We can use terms like epidemic or pandemic when it becomes a bigger, more global scale infection. This is not what we call an epidemic. This has entered close to pandemic proportions, and that's definitely worthy of note. Here in the United States, of course, your risk level is reduced, but it doesn't mean that situations like that maybe shouldn't fall on deaf ears. Like I look at that and it's like, you want to go help, even if it puts you at risk, you have to ask yourself what can actually be done. Excuse me. Oh, I started to get breath. Oops, excuse me. All right, so the other side of it is there are several other types of viral infections that have an impact on us, and we may be unaware of what they may potentially do for you. I'm not going to do the videos on polio, although many of you may know a little bit about it. Again, that is actually one you can pick in a future week if you're so inclined. But check out what happens to a female that contracts rubella during pregnancy. Rubella during pregnancy will cause severe birth defects in an infant to the point of deafness, cataracts, low birth weight. Oftentimes it can actually be deadly. Depends on when the rubella is contracted, but you guys, those of you that have had your vaccinations, you should be considering the fact that you had what we call a measles, mumps, and rubella shot at that time. Rubella being less common here in the United States doesn't mean that it isn't still a global condition. In the United States, we have had cases of it. It's just less and less common with vaccination schedules being on point. That's why oftentimes a female that has not had vaccination that gets pregnant, she's going to be monitored exceedingly closely by her OB/GYN in the case of any of these scenarios here. So rubella alone in an individual that's healthy or even an individual that's not carrying, not a high risk factor, but again, in the case where somebody contracts that virus during the essential stage when they're fostering or maturing that offspring, that embryo inside, to moving it onto a fetus, can end up leading to very deadly consequences, even to the mother as well. So some viruses have long-term impacts. It isn't just, hey, I got it today and I'm sick today and then tomorrow I'm totally okay. No, some of them leave long-term impacts on others. Viruses have some of the most mutatable features. Remember, this is a question that I know some people missed on the exam. What does a virus, I'm gonna pause myself, retract. Does a virus have a metabolism? No. If a virus doesn't have a metabolism, then how does it cause all these infectious diseases? What does it actually do? Well, think back a little bit to the last time we met together. It causes a lysogenic phase sometimes, but when it starts to be lytic and break open those cells and spread and share itself with the world, that's when the virus can be at its most toxic time. Well, viruses have to find ways to evade your immune system, the same immune system that performs immune surveillance with those natural killer cells. And so they find ways to evade the immune system by mutating themselves. Viruses mutate at a rate that bacteria can't even keep up with. Viruses mutate at a rate that we definitely don't keep up with. We have a set of checks and balances that keep us from mutating too much. Too much mutation in us gives us cancer. Too much mutation in a virus makes it a pandemic disease, or potentially jumps it from one species to another species. So we go from having a pig-borne virus to something that can infect humans is because it can mutate itself. And sometimes so fast that we in the healthcare community can do nothing to combat against it. So we look for different types of means to control that, to predict against that viral mutation. We also use things, talking about interferons, as a part of the therapy against certain viruses. So there are strategies to combat it, but I can tell you guys, it's been pretty mixed. All right, you ready for some viruses themselves? All right, first one we'll go with parvo. Human parvoviridii can actually cause a disease called Fitz disease. Fitz disease will present itself commonly in children, especially in like daycare or like just school-based settings. But it isn't typically deadly. What the long-term impacts could be that if left untreated, it can cause broad-spectrum anemia. I believe also it has hemolytic properties. It's a single-stranded DNA virus, which actually means that it doesn't, and it's not enveloped. So that means that it can be left on a surface without any problem, left for a long time. But the fact that it's single-stranded doesn't give it as big of an impact. Certain viruses with different types of genetics have a different impact on what they can do for us. Adenoviruses, these guys are big ones, very important ones for when we do things like gene therapy. And if you looked at this week's Week at a Glance, I was talking about how we use viruses for gene therapy and delivering genes. If you are sick and we want to try to find out what's wrong with you, and we say, wow, one of their genes is mutated. Well, one of the theories is that if we know you have a gene mutation and it means that a protein inside your body isn't being produced properly, we have the concept of trying to treat you by replacing or returning a healthy version of that missed protein. Well, adenoviruses are the ones that we use to help us with delivery system for that. Adenoviruses can cause a lot of respiratory infections in people. Another type of double-stranded DNA virus itself is the papillomavirus family, or the papillomaviridii, or papoviridii. And these guys cause warts, as you know it. The thing about them is these ones are the ones that we can pretty exclusively link with things like cervical cancer. So you can link HPV infection, specific two types, the 16 and the 18 serotypes of the HPV virus, and several sub-serotypes of them have actually been linked with cervical cancer. So many people out there are getting that, what is it, Guardia vaccination. It actually can be clinically indicated in individuals in their early 20s. It depends on what your risk level is. Some insurances now will still pay for individuals that are no longer in that early stages, but maybe getting closer to mid-adulthood. I remember when the vaccine came about, because it's been out now probably about 15, 16 years, probably close to 14, 15 years. When that vaccine first came out, they weren't offering it to people over like the age of 25. But now, if individuals are in high-risk lifestyles, not in monogamous relationships, things like that, they'll actually, sometimes insurance will actually cover the vaccine. Definitely interesting. All right, here's to creep you guys out. This is a case of smallpox. On the right, what you're seeing is a case of smallpox giving off that pocked appearance. These are poxviridii, still a double-stranded virus itself. Here is HSV, or herpes simplex virus, another double-stranded one. But herpes simplex virus and varicella virus are the ones that you may know of a little bit. Anybody remember what varicella does? Chickenpox and shingles, so that one should maybe be a little bit one that surprises you. We actually know there's a type of the herpes, herpetiform viruses called HHV8 that causes a type of cancer called Kaposi sarcoma. So even these types can be linked with different types of tumors. And that's the same one you see here, it's just a cold sore. But that cold sore is caused by a latent infection of herpes simplex. If you ever have gotten a cold sore in your entire life, and you were to go into a physician's office and say, hey, can you test me to see if I got herpes? You know, maybe you're thinking about genital herpes. Well, they'll oftentimes say to you, sure, but you're gonna come up positive. Have you ever had a cold sore? And you say, think so, or canker sore in your mouth. Well, at the end of the day, this class is responsible. The ones that cause genital warts are a subclass. I think we've got like HHV7. There's several isoforms above that. So several of the higher ones can actually present themselves in the genitals. This is hepatinovirus. This is the one that causes the hep class of them. And hepatitis actually infecting and wreaking most of its havoc there on the liver. But definitely has presentation in other tissues. Again, that's a really interesting virus to pick to learn more about. I don't have pictures on this one, but a very interesting one to pick and learn more about when the time comes if you just want to understand why hepatitis infections are as big as they are. Hepatitis A being more of a foodborne, less of a long-term risk one, but the hepatitis B and C family being very significant. On a global scale, hepatitis actually can be one of the leading causes of viral-based tumors across the globe, and one of the places in our world that has some of the highest rates is actually China. China has some of the highest rates of hepatitis infection, and as a consequence also has very high rates of hepatocellular carcinoma, which is liver cancer. There was a question, Itza.
So what makes them move or stay like in certain parts of the body?
Yeah. The presentation, it can be based upon how those viruses target to specific cells. So we'll use like HIV, an example of one we've talked a little bit about already. It can specifically target to a protein on the surface of T cells. And not just any type of T cells, helper T cells. So there are presentations on our cells. Our cells all have the same genes, no matter what cell in our body, right? But many of them, as they differentiate, become specific and unique, start to present different characteristics and features. So if I take your skin cells, they have different things on their cell surface than do your liver cells, than do your heart cells. And so those different things can actually be the targets of the viral infection. So that's why a herpetiform rash will give you a herpes virus will give you a very distinct, almost herpetiform rash. I'll show you a picture of it if it helps. They look like that though. And they present themselves because what they're actually doing is breaking apart the upper layer of your epidermis, causing that ridge-like, the lower layer of your epidermis, causing that ridge-like appearance. I'll show you a classic herpetiform rash. That's why you can go into a physician, have one of 10 types of herpes virus, but they'll know instantly because it presents itself in a similar way. All right, so herpetiform rash. Get ready, guys. It could be gross. I have no idea what's coming. They present themselves in a blister-like fashion. Let's see if I can find you shingles too, just to throw it. They will present itself in a ridged blister-like fashion. I'm trying to get one that's not, maybe that's dermatitis herpetiformis. They will come up, they will peak up in the center, and it's all as a consequence of how they degrade the tissue down below. Herpetiform rash, let's do shingles. Shingles is just not fun. Early shingles will typically take on a presentation like that right there, where you can see them mounded and risen, sometimes on top of one another. Late shingles, after it's beginning to heal, may present itself with more of the crusts on the top as the rash begins to heal itself. So a physician can probably spot certain ones, but some viruses won't present with a classic set of symptomology on the skin. They're going to present themselves in different tissues, and that's actually part of the emphasis of the last part of our class, is looking at which diseases, bacterial, fungal, protozoan, even helminths, affect different body systems.
Hepatitis B is transmitted by stool and B from blood.
You can transmit A through blood as well. I think you can probably transmit B through stool if there's enough of it. Hepatitis B is an interesting one because it can actually do fomite transmission, which means this table right here. If you had left behind enough bloody hepatitis B, and then I go and I have a cut on my hand, so now I don't have that physical barrier of my innate immune system. I put my hand on it, rub it all over it, that hepatitis B could potentially be contracted through that bloodborne fashion. So hepatitis B, if I give you a hug and you're a Hep B, no, you're not going to get it just by aeration. You actually have to have a route of transmission of entry into the blood. So I wouldn't be hanging out with anyone with hepatitis B, especially if they have open sores or lesions. That would definitely be something I would keep an eye on. I wouldn't share drinks with them, but I wouldn't be afraid to come and visit them at the hospital with the right proper PPE precautions. I'd be washing my hands a lot. I might even want to. The mask does nothing. We already learned, right? Because what are viruses? Are they filterable? No way. They're ultramicronic, right? So they're ultra filterable. So short of a nice, fantastic HEPA filter, which, again, with a respiratory capacity, because you can't breathe through a HEPA filter fast enough to get your oxygen. So you would actually have to have a forced inhalation filter on your mouth. Yeah, no good. Those individuals even walking in there to do what they're doing with Ebola, it's tough for me to watch because just a small mask isn't going to be adequate to protect you against that virus. Okay, so rhinovirus is a type of Picornaviridae. Hep A is actually similar to it and falls here. Poliovirus will fall under this class, and I do have that video on polio you might want to check out. Norovirus is another single-stranded RNA virus. Norovirus, caught from actually Norwalk agent, causes probably one of the most common leading causes of foodborne illness related to a virus, even more so than hepatitis A. So I like to gross people out usually because this one is like the cruise ship virus. You always hear about people that go on the cruise ship and then like everybody eats bad food and they all get sick. Well, usually when they're vomiting profusely and diarrhea out of that other orifice, they are typically, if it's a viral cause, it's going to be noro. Noro is the one where maybe you get to the point where you might have been thrown up and potentially had diarrhea severe enough, you might actually go to the hospital. They'll throw you on an IV for fluid recouping, and then they'll send you out. There's not much that can be done to treat it beyond just letting it run its course. But it seems to trigger and target specifically only to the gastroenteric portion of you. It will cause a fever. It's just the fever won't be the same and it won't spike to the higher temperatures that maybe an E. coli infection would do in the same breath. This one is alpha viridae causing the rubella. This is a case of what rubella would actually look like. Some can be caused by direct transmission, and some we're going to be getting into what we call vector-borne or arthropod delivery. What's an arthropod? Ooh, never heard the word arthropod? Okay, guys, we're getting clinical now for a moment. Arthropod is going to be our scientific term for a bug. Okay, so an insect. An insect is an arthropod. And so that's important for you because arthropod vectors are going to be things like ticks that deliver Lyme disease to your patients. Or here in the Southwest, what are some tick? We have a couple of tick-borne illnesses. We have a brown tick fever, right? What else can you get? Well, we know that malaria is delivered. It's not going to count as a virus, but it's delivered by mosquito larvae. So we have lots of arthropod vectors. That means they deliver. All right, guys, this one is flavivirus. This is a class of viruses that can cause yellow fever, dengue fever, West Nile virus. That would be one I should have thought of right there. Coronaviridae, most of the time not even deadly at all. Here's rhabdoviridae. This guy is our rabies. Animal diseases very strongly for that one. Here is the filovirus, and Ebola itself gets the notoriety, although the Marburg virus is very similar to Ebola. This is actually an image of the Ebola virus itself. So it really likes to bore holes in through the cell. It's a very aggressive virus that causes broad spectrum tissue necrosis without spending a lot of time worrying about going lysogenic. It never even enters a lysogenic phase. It always just lytic, and it always just kills the cells. And that's why individuals start to bleed out through even their eyes, through other orifices like their nose and their mouth. They will bleed necrotic dead tissue out of those because it just starts attacking those pathways. So yeah, it'll be like blackish red coming out of eyes and noses, and even ears can actually be sources of it. This guy's parainfluenza, and mumps would be the big one. Mumps, you see here how he's got those distended lymph nodes indicative of mumps. Delta virus, relatively low, but it actually is a co-infectious virus. I don't know why it did that. It did this to me last time. We're blacked out. Influenza viridae are caused by orthomycoxy viridae themselves. I think I just need to delete delete this guy. And these guys are all single-stranded, but they're RNA-based viruses, so they already have their genome, so they get fast infections when causing that. This guy right here, the bunny viridii, can actually cause hantavirus. Does anyone know how you get hantavirus? Heard of it before? Hantavirus cases are very common, more common in New Mexico than they are here in Arizona. However, hantavirus is here in the state of Arizona. And where you will get hantavirus is by rat feces, mice feces. So the delivery system in this particular case will go through the rodent delivery system, which is dangerous because people that aren't keeping their homes, or they live near washes, or have maybe even like a house with property that might have any kind of pack rats or something like that, they could be carriers. So even going out to clean up the feces, let's say you have a case of it, it's outside, you go out to clean up the feces, your chance of inhaling it increases your risk of it. And we'll let somebody maybe pick hantavirus for one of the presentations. It would probably trip you out at exactly what it can do. This guy, Lassa virus, right here, is called an arenavirus. It's still a single-stranded RNA virus, causing a pretty aggressive one. It's not very common. Your text does have some stuff on Lassa, though, if you want to learn a little bit more about it later. Oh, I didn't mean to delete that one. I'm just trying to figure out why it blacked out the. Can't get it to pick it. I just want it to pick. There you go. Retroviruses as a whole include classes of retroviruses such as the ones that cause HIV. This one can talk about being more of an oncogenic virus. We know that retroviruses that have that reverse transcriptase, making them a retrovirus, go from having RNA and turning their RNA back to DNA. Remember how DNA to RNA is the direction we want to go? Retroviruses are the one class that can break those rules and reverse it. And the only way they do so is with the presence of reverse transcriptase. Well, these guys are particularly scary because that reverse transcription can now maybe potentially insert their genome into ours. Remember when HIV becomes a part of us and that's really darn frightening? Hope you guys are remembering some of this stuff. So it's just bringing it back to you. And then these guys right here, Colorado tick fever might be a class of these ones right here. They are double-stranded RNA. There's not very many of those. In fact, it's the only one on our list. But these guys can cause different types of infectious disease, and that would be one class of them. All right, guys, so that was the end of chapter 6. And I don't know about you, but it makes me want to like skin crawl when we start talking about the different helmets. But viruses, there's not much we can do. It doesn't make my skin crawl. It just makes me feel like never entering public again or shaking hands with anybody for the rest of my life and living with HEPA filters all around me. Unfortunately, you can't put yourself in that bubble, but you can see now how there's a huge spectrum of different types of viruses out there. I strongly encourage you that if any of those you're like, wow, never heard of that before, or oh, that looks kind of creepy, that you guys take some time, put that down on your little list, because we have a big project coming up where you get to pick an individual specific virus to learn about, or specific pathogen to learn about. And so the list has most of those, and of course if you advocated for one that's not on the list that I have, I would probably very much welcome you to do some additional research on it, okay? So keep in mind all that creepy crawly scary stuff. It is not 11 yet, so you know what, rather than even starting on chapter 7, what I'm going to do for you guys now is give you a quick little heads up about the lab for this week. So you guys, sterile techniques, I saw some successful sterile technique, which is